Mr. President, I would congratulate my colleague from Missouri for the excellent comments that he made, and would bring to the floor a report that came out last evening, which is essentially the analysis that the Obama administration never wanted the American people to see. And it has to do with Obamacare from 2013 to 2017. And this report that the Obama administration would love to hide from the American people makes the point that my colleague from Missouri just made. In those years, from 2013 to 2017, once Obamacare came into place, premiums around the country in the states that are buying on the federal Obamacare exchange, premiums went up 105% on average. 105%. More than double. More than doubled in 20 states, tripled in 3 states, Oklahoma, Alaska, and Alabama. In Wyoming, we went up 107% in just 4 years. Tell me something else that's gone up by that price in your life, in our lives anywhere, over that short a period of time. But those are the numbers that are out today. So now, more than 7 years ago, the Washington Democrats wrote an enormously costly and complicated health care law. And they forced it through the Senate, and they made lots of promises. They promised it would provide care for less money. They promised you could keep your doctor, you could keep your insurance. They promised if you just allowed Washington to have more control, that everything would be better for you. Hasn't worked out that way, Mr. President. These are the numbers we're looking at today. And it looks like prices are going to go up again next year because of the mandates and the requirements of the Obama health care law. In Connecticut, insurance companies say they want an average increase of about 24%. In Maryland, the average of 45%. In Oregon, 17%. Americans are facing, again, double-digit increases in their Obamacare premiums next year, just like this past year. Some companies just said, hey, I'm done. Not going to sell anymore. Just not worth it. That's what Aetna's done, pulled out entirely. And the thing that's so interesting about Aetna's decision is they were one of the major cheerleaders early on, back in the beginning of Obamacare, saying, oh, yeah, we want to do this. We want to sell insurance all around the country. Well, now they're pulling out of Obamacare all across America. What that means for people at home is they have fewer choices. People living in 2/3 of the counties in this country, and in every county in my home state of Wyoming, are down to fewer and fewer choices. We have one choice, just one choice of a carrier to buy from on the exchange in Wyoming, but in 2/3 of the counties, people have only 1 or 2 choices. And there are now places where people have no choices. Even if they get a subsidy under Obamacare, there's no place they can use it. So it's useless to them. Now, the companies that remain, what are they doing to help try to control costs? Well, they're cutting back on access to doctors and to hospitals, as we just heard the situation of the patient in Missouri. Democrats say that people have to buy the insurance anyway, because they say they put a mandate on it. Americans, like it or not, you have to buy Obamacare insurance. If you don't like it, we're going to fine you. That's what the Democrats said. Well, in spite of the mandate, 20 million Americans said no thank you. About 8 million paid a fine. Another 12 million got an exemption, because there are actually 41 different ways you can get exempted from Obamacare. People realize that it's not a good deal for them. They know that Obamacare has made insurance so expensive that it's not good value for their hard-earned dollars. And it's astonishing to hear Democrats now say that Obamacare, basically the problem was that Washington didn't have enough control. We need more government control, they're saying. There are a number of Democrats that want a single-payer health care system. Some call it Medicare for all, call it what they want. It means higher costs, more Washington control over the health care that American families need. The state of Vermont looked at this idea a couple of years ago. Even in this very small, very liberal state, they dropped the idea almost immediately. Why? Because they said it was too expensive. Didn't stop other states from looking at it. Most recently, the state of California is a place where this has occurred. Democrats in California recently offered a plan to have the state take control of all health care for everyone who lives there. Universal health care for all, they call it. Doctors' visits, hospitals, inpatient care, outpatient care, emergencies, dental, vision, mental health, nursing homes, everything, cradle to grave. Universal health coverage. So what do the stories in the California papers say about this? Well, they did a budget analysis. The state of California, their budget office did a budget analysis, said, what would such a thing cost? They came up with a cost of $400 billion a year. Now, it sounds like a big number, but how do you put that into perspective? What else can you do? $400 billion. So they said, well, let's compare it to the budget of the entire state of California. The entire budget for the state of California today is $190 billion. So the cost of universal health care alone is twice the budget of the whole state of California. Well, that includes teachers, firefighters, police, everything. And they're proposing to spend twice the amount that they spend on everything on universal health care. So what do the Democrats say? Well, we'll just have to raise taxes. That's their answer to so much of everything. I guess they figure that hardworking families in California would need to pay these taxes every year, not just once, every year, because that price tag is $400 billion each and every year. Democrats have no good ideas on how to deal with this collapse of Obamacare. Republicans are offering real solutions. We're looking for ways to bring costs down, to give people more freedom, to give people more control over their own health care. We're working to make sure that people can get the care they need from a doctor they choose at lower cost. We don't have that with Obamacare. The Democrats are pushing the exact opposite approach. They're offering higher costs, higher taxes, more government control, more government say in your family's life. Mr. President, Obamacare has failed. Republicans are committed to finding long-term solutions to our nation's health care needs. Thank you, Mr. President. I yield the floor.